So good afternoon and welcome to the CommQuest Services community discussion. Today with me, I'm Keith Hochadel, President and CEO of CommQuest, and today with me is Wendy Hunter. Wendy is the Senior Director of the Detox Unit that CommQuest has in Aultman Hospital, and we're going to talk today a little bit about the detox services for CommQuest. This is a new program for us. Many of you know we have had a detox unit in the Alliance Hospital and one out at the Regional Center for Opiate Recovery, which we relocated. So Wendy, welcome, and tell me a little bit about yourself.
Oh, let's see. Where do you want me to start, Keith? Long time ago,
Yeah.
I came to work here at Quest. And now we're CommQuest.
Yeah.
So, we have been through a lot this past year. In the past year, we went ahead and got into a contract with Aultman to have our unit moved from Maslin at Recor to Aultman Hospital's 6th floor. So that process ended in February, and we kicked those doors open, I believe, February 27th. Yeah, so we are a 20-bed unit. Very happy to be there. I'm very excited to be working with the Aultman staff, the nurses, the doctors, the ED department. Everyone's been so welcoming and so helpful. We love housekeeping, their maintenance crew. They are very responsive and helpful through all this.
That's awesome.
Yeah.
And I think, as I was reading in the newspaper recently and recognized that the number of fatal overdoses in our community went up after a couple years of decreasing. I think detox services are really important because they're a first step. So can you talk a little bit about kind of what that process is for people to get into that program?
Sure.
What kind of medication, what kind of substances of abuse people can be on?
Yes.
So that'd be helpful.
For those who are interested in detox and want to know more about it or want to know about it for themselves, we are a medically managed detox program. And so that means we're looking at detoxing people from alcohol, benzodiazepines, which would be something like an Ativan or Xanax for those who do not know what a benzodiazepine is. We also, of course, detox those from opiates, heroin, fentanyl, carfentanil. So those are the three big ones that we take care of.
Yeah.
And all it takes is a phone call to see if we have beds, or it just takes arriving at the Aultman ED, the emergency department, and walking in and saying, "Hi, I am here for detox," and their staff will greet the person and welcome them to the hospital and take their name and tell them where to go sit to wait for us, and they call us upstairs, and we come down right away and meet with the person and start the admission process.
And I think you and I worked together for a long time, and I think we share that same sense of urgency for people to get help. And I think that as we've been going through this whole COVID-19, everything that we've been pushing is, hey, we're an essential healthcare provider on the mental health and the drug and alcohol side, and we're only a phone call away.
Correct.
And I think that's important for people to recognize. And I would imagine that when people get to detox, that maybe they're surprised at how much like a medical model it is.
Yeah, I think people don't realize what a diverse team we are. When we have somebody come in and present, the ED will call us and we go down, and we always try to send a counselor and a nurse down because we know that it takes both. We want somebody to lay eyes on them and talk to them and see what's going on, to make sure that they don't need any type of medical services that maybe the emergency department would need to provide them. But our nurse and our counselor talk to them. We do a quick screening, and then we take them upstairs to the 6th floor. So, it's a combination. We want to approach this as a team. We want to make sure that clinically we're good to go, medically you're good to go. We get you upstairs, you get through a diagnostic assessment with the counselor. We go ahead and get you with the nurse to do their part, and then we have the doctors and the nurse practitioners. And then while you're there, you have 7 to 14 days of a stay working with that entire group. And we all work as a team. We operate as a team, we communicate as a team, and we're going to discharge as a team. So your discharge plan, which is just as important as your admission, discharging starts always, right after admission, is a team approach to make sure that we get connected to the right services at the right time.
Sure. So what's that typical day look for some, after, I know the first couple days are challenging because people typically don't feel well, but what's day 3, day 4, what's an average day look like for somebody?
An average day is you get up, you get your medication in the morning with the nurses are checking in with you, making sure that you're doing okay, they're checking your vitals, your temperature, seeing what's going on. The RTs, our resident techs, they're there to give you some support. We have breakfast provided. From there, counselors, start their day at 7 a.m. So counselors are coming in and they're checking in with the nurse, with the RT, seeing how the midnight shift went. And, starting with anything from you can have some individual counseling in the morning, some discussions about a treatment plan, your discharge plan. Somewhere in there, you're going to do some counseling one-on-one. Due to COVID and some of the COVID restrictions, we have limited how much group we've done. So group is determined by how many do we have on the unit right now, what room would we be able to safely provide a group service. Normally pre-COVID, which is an interesting new word, I've realized I say a lot. Pre-COVID days, we were doing group once or twice a day. Now during the COVID days, it's a hit or a miss. But group is still always an option. Staff, they love to provide group services. It's one of the favorite things they do. So we do it as we can to keep everybody 6 feet apart, good social distancing, keeping the counselors safe, and keeping everybody engaged. And then you get medication throughout the day. You're going to have time to go sleep. You're going to have time to talk to people. You're going to have time to talk to people about how to get connected to 12 steps and outside support, as well as clinical support and treatment.
Sure. And I think that the one thing that I appreciate about our detox units is, there's a lot of places where people can go and they just think, I'm just going to lay around for 3 or 4 days and then I'm going to go home and go do what I was doing before. And really, from the first time we even started talking about detox units, to me, that was what needed to be different. We needed to be providing treatment and getting people up and getting them moving around. And you guys have done a tremendous job of making sure that happens. And I think the other part is the benefit of having a full continuum of care within the agency and to refer folks out. So can you talk a little bit about kind of the options that I know you start talking about when they first get there, about where they might go next after detox?
The thing that we do is we're going to talk to them. We're going to get through that assessment with them. Counselors are going to talk every day with each other. I have 2 counselors that work 2 12s every single day. So I have I have 4 counselors. So the 2 that work on Mondays, they come back on Wednesdays. So then the 2 that work on Tuesdays. So there's good communication between the team to make sure that we're identifying what does this person need. So are we looking at needing to link somebody to services for their opiate use disorder? And if so, are we going to look at putting them over at ReCore for some type of medication-assisted recovery? And from there, is there a possibility that they also need some mental health services? So then Cleveland Avenue, probably Candace is going to get some communication from us in regards to, hey, what can we do to get them, in front of a nurse practitioner for some psychiatric services? This person has a history of depression. We're seeing the depression or some anxiety or PTSD. They had meds in the past. Now they need some more. They could really benefit from that, as well as maybe some counseling as well for the mental health services, which we really were trying to encompass everything. We're going to work with the nurse practitioner and the doctors to say, what kind of primary care services do they need? Do we need to link them to a primary care service provider? Do we need to find that also for them within the community? But within CommQuest, and within Stark County, we have so many options. We've got the mental health option. We have the residential services. Based off of the ASAM criteria, if they need the residential services, we've got the women's houses. We have Deliverance House 1 and 2, which are both great to work with, trying to move somebody. We try to make sure there's no interruption in service. So if you're going to go to residential and you're sitting on the detox unit, we move you right from that detox unit into that house. Wilson Hall is our men's residential, as you know, in Massillon. So again, if they need all those services I talked about with the OTP, the opiate treatment program, and they need Wilson Hall or Deliverance, they can get all of that, and we can link them, get all those appointments set up, and have a solid discharge plan.
And I think that's to me, one of the most important parts in successful treatment is not sending somebody someplace else.
Right.
If I go to my primary care doctor and he tells me, hey, you need to go for a sleep study, call them or they'll call you, I'm probably not going to connect with that call.
Right.
But if somebody's making that warm handoff and I know where I'm going and I know who I'm going to talk to, and frankly, in a lot of cases, I know we're transporting them to those places also.
Yes.
To keep them from making those at times intermittent stops along their way to get somewhere that then they don't get there. I think that's important as well.
Right, we do. We make sure that it is a very warm handoff, because so many times people will want to go home for a day to take care of things or pick up some things. And we assure them that while you're in detox, you can have your family or friend drop those things off. You know, if you're telling me you need clothes, we can make sure that the clothes get dropped off.
Yep.
You know, if there's a certain pillow or blanket you want, you can have those dropped off.
Sure.
So there doesn't have to be any interruption.
So can you talk a little bit about, you know, we're in this whole COVID, you know, prevention thing, which I think that everybody's doing a really great job around prevention. Can you tell me kind of what it looks like for somebody that needs detox, has either made the phone call or made the commitment to come in, and they walk into the ER? What's that look like? What's that feel like? What's that sound like? So that they can be prepared.
Sure. You know, right now, as things are opening up, the hospital is getting a little bit busier again. But when COVID, you know, when we had the stay-at-home orders and things, you know, really quieted down at the hospital. So now it's going to look a little busier. However, it's still very safe and very solid in the protocols. So you're going to walk into the hospital ED, the emergency department, and say, "Hi, I'm Wendy, and I'm here for detox." They're going to take your name and call us up. But in the meantime, before you can step any further, they're going to want to take your temperature. They're going to ask you some questions about some symptoms to see if you have any symptoms of COVID, and they're going to provide you with a mask. You're going to wash your hands, and they have hand sanitizer all over the place. The hospital is extremely clean, very sanitary. So, you know, that's the one thing I can say that all of us have noticed, is that within that hospital, Aultman standards of cleaning and making sure things are sanitary are at the top. So then we come downstairs and take you upstairs, and same thing. Our unit, you know, Aultman staff, the CommQuest staff that works on the team at Detox, we are all in mask. We do social distancing the best we can. You know, when you do sit down with the nurse to get your medication, you're going to be asked to be masked up. The nurse will have their mask on, but you're going to take your medication. You're going to take, you know, pop the mask down and take your meds. And so again, we've got hand sanitizer. We did limit the beds for a while to make sure everybody was safe. We went ahead, instead of having 2 people in a room, we had 1 in a room. We're slowly going to go back to putting 2 in a room. But again, we're asking some of the same questions that Aultman asked in the beginning. We're going to ask you for your symptoms. We're going to take your temperature. Nursing's going to take your temperature at least once a day, if not twice. We have a plan if somebody comes up with a fever. Not every fever is COVID, but we recognize that. But it doesn't mean you're not contagious with something. So, you know, we've got a medical plan on what we're going to do with that. But we're very cautious. You know, lots of hand washing, lots of talks to the staff as well as the clients. Make sure you have good hygiene. Make sure you're washing your hands, using the hand sanitizer we have all over the place. Put your mask on, and you know, at this point, that's about where we're at. And again, the hospital's cleaning the rooms. The hospital has housekeeping up every day, and when someone leaves a room, they're using the ultraviolet lights that they clean in any of their rooms in any place in the hospital. It comes up on our unit, and they use it in our unit also. And then that room is locked until the next person comes in. So the rooms are not in jeopardy of anybody just going in and out of after it's cleaned. We're shutting it and locking it until the next admission comes along.
That's fantastic.
So.
I know that when we opened the kind of the precursor to the detox unit in Aultman, when we opened the Regional Center for Opiate Recovery in Massillon, one of the reasons that we opened that was just it was in the middle of the early stages of the opiate epidemic in 2015, and the draw from the region was significant.
Correct.
And I know that,
Yes.
that as an agency, we've touched about 62 counties. So, you know, I also know that where we are now, it continues to be a regional program. Can you
Yes.
talk a little bit about if somebody's coming from out of county, what that looks like, and to assure them that, one, they don't have to live in Stark County to be able to receive that service there, and also there are multiple payer sources that we accept for services.
Yeah, so out of county, we take a lot of phone calls for out of county. In that phone call, we're asking, you know, your basic demographics, and we're going to ask you about your payer source, and we're going to figure out, you know, especially if you're Medicaid eligible, you know, we'll help you get signed up for that. We're going to walk you through what we know about your insurance. We take many commercial insurance. We have a fantastic group of staff that can help people and explain that to them, but we tend to not have to turn too many people away for inability to pay or any payer source lacking, because we have a lot of resources that we can look into for them. And we also work very closely with many of our surrounding counties, and sometimes those counties, you know, depending on what they've agreed upon with us for detox services, they might help cover some of that cost as well. So we take from anywhere within the state of Ohio. We just always tell people, before you drive up 4 hours, just call us, make sure we have a bed. That's my worst nightmare. Somebody gets to us and we don't have a bed. Thankfully, we have our other detox unit in Alliance, but there are times where they're full and we're full. So I don't ever want to turn people away that have driven up, and you know, it's just simply as simple as we just don't have the bed.
And I know one of the things that's been pretty cool to watch is as our commercial insurance business has grown a little bit. I think that sometimes people don't look at CommQuest Services as a not-for-profit, as somebody who's taking, you know, whether it's AultCare, Medical Mutual, or any of those things, and we're taking those. We're in a hospital. It's the same setting as if you go someplace else, and you're going to get great care, and we're going to link you to wherever you want to go next. And
Absolutely.
I think those things are extremely important. So I guess the last thing I want to hit on is we have the ability when somebody's in the hospital. So if somebody has a loved one in the hospital for whatever reason it might be, it could be complications from their substance use. It could be because they had surgery and they're in pain, and they know in the past they've abused pain pills. So what's that referral look like to us when somebody has a loved one in the hospital and they'd really like them to get some help?
Actually, we just had another floor consult today. As the hospital has been opening back up, thanks to the governor starting to say that, you know, hospitals can provide the services
Child care's
they
coming
did.
open,
Thank goodness, child care. Lots of celebration, I'm sure, at homes tonight. So right now, usually the social worker of the floor gives us a call, and she or he will tell us what's going on. We'll identify the person and say, can you come down and talk to them about services? And many times what we have found is that they're not quite in need of detox because they've been in the hospital long enough that they have actually detoxed. So we're linking them to outpatient services within our agency. So we go down. It's one of my favorite things to do. I have fun doing it. We take a nurse, one of the counselors, which I always remind people I am a counselor by trade.
Yes.
So I enjoy doing the screenings. I enjoy going down to the floors and working with that person and talking to them, talking to their families if they're around, letting the social worker know. I've even had the pleasure of running into a doctor or two that's interested in what we can do and what kind of referral that I'm thinking I'm going to make or the staff's going to make. I think that right now the staff hasn't included me on too many of these because I think they know I was enjoying it too much and they wanted to get their hands in there. So the counselors and the nurses have been teaming up and going. And it's nice to get those calls again. When we first got there, pre-COVID, we were getting a lot of calls for floor consults. And I enjoy just knowing that I can get on the phone and talk to any of my colleagues in this agency and say, hey, this is what I got going on. Could you get this person in and be able to let that social worker know, I've got an appointment for you. Would you like me to, and I always offer that. I'm like, we can go ahead and make the appointment for you. You don't even have to make the phone calls. Here's what I can do. And so it's part of the conversation with that person. It's like, so could you be there on Tuesday at 2 o'clock?
Mm-hmm.
And
Yep.
that's how we work it.
That's important. Those connecting points are one of somebody told me it probably hadn't been that long ago. He says it's actually chain of custody of the client. We actually have custody of their care, and we want to make sure that they get the best care. And for as long as I've known you, Wendy, you have always been client-centered care, and we appreciate that. So
I love it.
Well, so anything else you'd like to share before we wrap up?
I thank everybody for just being with us and supporting us. The staff has been wonderful. The detox team, we haven't stopped. Pre-COVID and COVID for us looks the same.
Yep.
We just have to wear a mask and wash our hands a little bit more often. And a lot of hand sanitizers means a lot of dry hands.
Yep.
But we've appreciated the support. Everybody saying thank you and being patient with us when sometimes we're getting tired and getting a little cranky at times. And but my staff, I'm so proud of them and so happy that I feel like we've seen it all now. And, now. We
don't want to see another pandemic.
No more pandemics. It's like I told staff, we had a lot of things we were predicting that we could do when we hit the ground running at Aultman, but we couldn't predict a pandemic.
Sure, nope.
But now, but thank you, and thank you, Keith, for this opportunity.
Absolutely. So again, this is Keith Hochadel, President CEO of CommQuest Services, with Wendy Hunter, our Senior Director of our Detox Unit in the Aultman Hospital, and this has been CommQuest Community Chat, I guess we'll call it. So
It's a good
thank
chat.
you.
Yeah, thanks.